Morning, a new report highlighting racial inequity in the wake of the pandemic and charting a path forward. The report is part of its annual series of the State of Black America and urges America to continue the unification that was present in the early days of the pandemic last year. I want to welcome to the program this morning the President and CEO of the National Urban League, Mark Morrell, and Dr. Lisa Cooper, Director of Johns Hopkins Center for Health Inequity, and a co-author of the report. Dr. Cooper is the author of Why Are Health Disparity Problems, or Why Disparity is Everybody's Problem, and I want to thank both of them for joining us this morning. Mark, I'm going to start with you.
Thank you.
Sort of walk us through the highlights, if you will, of the report, and what is the newest element here?
I think the new element, Andrew, is to understand that 2020 was a wake-up call on a number of issues. And now we have an opportunity to rebuild. But rebuilding should not be a return to before. Rebuilding should be this call to action to build a more diverse, equitable, and inclusive America when it comes to our economy, when it comes to health care, when it comes to the justice system. So it's a broad call to action. Authors like Dr. Lisa Cooper, with her brilliance and insight, help those who will read the report to understand what that means. And that's what we've tried to focus on, is a forward-leaning, prescriptive approach to this, more than being diagnostic, more than simply identifying the issues and the problems, but saying, because 2020 rocked this nation the way it did when it comes to health care, the economy, and justice, let's commit across the board, the public sector, the private sector, the non-governmental sector, to build a more diverse, if you will, equitable and inclusive America. I think that's the call to action of this report.
So, Doctor, what does it mean?
Well, I think it means that we are going to have to realize how connected we are. We are inextricably connected. We've seen, over the past 18 months that when one person is ill, we all are at risk. And so that's one of the things I talk about in my essay in the report and also in my book, is that we have to work together. And this is a complex issue. Our health is interconnected. It means that everyone, in whatever sector of society you're in, whatever neighborhood you live in, whatever state you live in, you have a role to play. And so we need to form partnerships.
But Doctor, make it practical for the viewer. We have a number of business leaders who are watching this program right now, political leaders, regulators. What are we actually saying here?
Well, we're saying that you can't only just focus on what's going on within your own organization or within your own business. You need to do that for sure. You need to look within your own organization to see if you have equitable practices and policies, and that you are being fair, and that you are making sure to address people holistically in your own organization. But then you also need to look beyond your walls and see who are your partners within your community. Who are those people that have a role to play in helping to create a more healthy community, and work with those folks. Offer services to your employees, or build programs together that focus on health and well-being, and that make your organization one that is more productive and just more humanistic. But also, it's better for us on an overall economic level if we are a healthier society and more equitable.
Shepard Smith here. Thanks for watching CNBC on YouTube.